between a heart attack, cardiac arrest, and heart failure?
Yeah, so they're all kind of similar. At the end of the day, the heart ends up stopping, but the difference is that there are different mechanisms. So when we talk about a heart attack could be a couple things. You know, there's a lot of loose terms out there that people just say, oh, I had a heart attack, but we don't know what that means. When you're talking to doctors, you're talking about heart attack. Usually that means we think of that as like chest pain, some sort of heart blockage for which you need bypass surgery or stents or something like that. But also there's another phenomenon that goes with that called cardiac arrest, which is in which the heart just stops and there's nothing you can do about it. So one aspect of it is blocked arteries and causing chest discomfort and making the heart not work. Recognize that the heart is a big muscle and it has arteries that give blood flow to it, kind of like plumbing to a house.
Right.
It brings oxygen and nutrients to the heart to make the heart work. Well, if that plumbing's blocked, then the heart doesn't work well, and that's what causes heart attacks. But on the other spectrum, there's sometimes the heart can have nice open plumbing. Arteries are nice and open, getting oxygen and nutrients, but the electrical system is damaged. So you can just have you can be sitting there one day and just have flatline, and that's called sudden cardiac arrest, and we see that as well. So it's really difficult to figure out who can have what, and fortunately some people have chest pain, some people don't. Unfortunately, this happened to our chef in town here, and he was a great chef, by the way. I've had his food, and unfortunately, he was doing everything right, and sure enough, he had a massive heart attack. And I suspect, we don't know the details of it, but I suspect he probably had some sort of blocked artery. Maybe it was from congenitally from or maybe his mom or dad, or he had some sort of family history of heart disease.
Yes.
We don't know. But the bottom line, at the end of the day, he did die of a heart attack. I don't know if it was sudden cardiac arrest or was it actually him having chest discomfort, blocked arteries, and then he had a heart attack and died.
So are there any signs or symptoms of heart illness? Like, when do we know when it's time to go to a doctor?
Yeah, so that's interesting because, I try and tell people, we can do all these tests in the hospital, but really you can do them yourself. So if you tell me, look, I used to run a mile a day, or I used to walk for 45 minutes a day, and now I can't walk more than 20 minutes without getting short of breath or chest discomfort or something like that, then that is your stress test. That's your stress test, right? I get worried about when people are sedentary and they don't do much. So like say they're just sit down, they don't get out of the house much, they don't walk fast, those type of things. Those are the ones I'm worried about because they really don't stress themselves. So we often do have more objective evidence in which we have them walk on a treadmill, try and do some sort of stress test, and that's it. But in terms of signs, you really need to do things yourself. You need to exercise, you need to walk, you need to be active, and keep doing that. And once you see that there's a change in that behavior where you start to feel a little different, that's when you know.
Okay, nice, very nice. So you did say like eating healthy and exercising does make a difference. So that was one of the concerns. I mean, he was only 36, he was doing the right thing. So is it the family background, like you said? Like, how does...
It could be so many things. Like I said, once again, we don't know the details, but all we know is that you can control what you can control. You can't control your family history. You can't control if your mom and dad had blocked arteries and they died at the age of 50. There's a good chance that you have those genes. Now, as doctors, we're always trying to identify who is at risk for sudden death or who's at risk for a heart attack. But from what you can do from your standpoint is eat right. And I can tell you, at the end of the day, eating right means as close as you can to a plant-based diet. Okay. That's the reality of it. There's a lot of data suggesting that as close as we get to a plant-based diet, whether that's vegan, vegetarian, or whatever, or as little meat as you possibly can, that helps. We know that. We also know that exercise, and it doesn't have to be running a marathon exercise. We know that walking, a brisk walk, 45 minutes to 50 minutes, 3 to 4 times a week, that goes a long way. Rather than being a couch potato using your remote control and just watching television.
Of course. So when you lose weight, do you know if there's still damage done to your heart that you can't really reverse?
Yeah, I think that's a myth. I really do. And I think of that when we talk about, I hear that from smokers all the time. Well, they say, what's the, I've already had a heart attack, I've already had emphysema, what's the value of stopping smoking? With a lot of value. It's a lot of value. We know as soon as you stop smoking, your risk of emphysema gets better dramatically. Your risk of lung cancer goes down dramatically. Your risk of everything goes down. Same way with weight loss. We know that your risk goes down dramatically. It's definitely better. So I don't want to have lost hope. I mean, I think that it's still hope, even when you lose weight or can't lose weight, or you want to lose weight. We don't want to discourage people from that. Definitely, your risk goes down tremendously when you do that.
Okay, so it does help.
And with the chef, from what I understand, with the chef, he lost weight 15 years ago.
Right.
So that doesn't really count. I think we should always try and strive. What we're looking for in our weight is to be at the weight that you graduated high school with. We've looked at that.
That's a little hard.
Yeah, but that's the number we're looking for. That's the number we're looking for. So we talk about, and there's data to suggest that whenever we're looking at what is your ideal weight, it's the weight that you were when you were at high school graduation.
High school, guys. High school.
High school.
So when you see someone that seems like they're maybe having a heart attack, is there something that a person can do to help in that moment? Yeah,
so the first thing we can do is recognize that there's something. And what do you have to do? You have to know your body. You know that if you feel some shortness of breath, don't be afraid to go to the doctor and talk about it. Don't be afraid. If you have some chest discomfort, if you have some indigestion, something like that people think, and it's not going away with antacids or Pepsid or whatever those medicines are, then that's something that you need to look at. Go to the doctor and try to figure out what's going on. Mm-hmm. Also, as mentioned earlier, continue to be active. That is our benchmark. And when you leave that benchmark, when you're either less active and you say you can't figure out why, those are the things that we need you to know your body and let us know when something has changed.
Of course. So if I'm in a room with someone and all of a sudden they're like, my heart, like there's something wrong, is there something that I can do? I wouldn't know what to do. I would ask them if they needed water. Like I wouldn't know.
Yeah,
what can someone do?
It happens all the time. And I tell you, we actually have a mission going on now that we're doing with the Chicago Public Schools here in Chicago. Because what we're realizing is that the first responders are really not us. They're not the EMS. Yeah. They're not the ambulance. They're really the people that are there, the people that are at the site, the one who's at a cocktail party with somebody and they're having chest discomfort. They're at a basketball game and they're having chest discomfort or something happens. The first thing you do is call 911. It's the first thing you do. And then you start just wondering, if you have to do CPR, you do CPR. If you have to find a defibrillator, you have to find a defibrillator. But whatever you do, the first thing you can do is call 911 and then worry about it after that.
What is a defibrillator?
Defibrillator. So, defibrillator. So, we call them AEDs. They're in many public places. All the airports have them. A lot of park districts have them and so forth. But the number one thing you can do is call 911.
Okay. 911, definitely. So if you're by yourself and you feel this happening and no one's around, is there something you can do for yourself?
Yeah. Get on that cell phone.
Just call
911 and then deal with it from that. Yeah.
Okay, got it. Do we have any Facebook Live questions from you all?
We have a lot of them.
I figured we would.
So, with regards to being the weight that you were in high school, a lot of people are saying, what if you were underweight or overweight in high school? What's a good way to measure?
Yeah, so good point.
Right.
I think that there's some calculations that we use. Okay, and there have been a lot of argument about, does that really apply to, people of color or something like that? But at the end of the day, the thinner you can get, the better. That's just the reality of it. We really realizing that. In terms of the weight, there is no standard, but there is a calculation that we use. It's called the BMI, Body Mass Index. And we know that people around this number of 25, that's a weight and height calculation. We know around that number that usually people do better. So we're looking at a BMI somewhere between 25 and 26, I think is where we need to be. That's our goal. And a lot of times people in high school are that BMI.
Yeah.
And then after that, it just goes downhill from there.
Another question, can I have heart disease and not have high blood pressure?
So the question is, can you have heart disease and not have high blood pressure? No question about it, yes. So heart disease comes from a number of reasons. Number one is, we alluded to earlier, family history. Can't control that. So there's what we call modifiable and non-modifiable issues. You can't control your genes. You can't control your genes, but you can control your cholesterol with medications
Yeah.
and diet. You can control your weight with diet and exercise. You can control your blood pressure with medications. So there's some people who have heart attacks and don't have any of those, whether it's family history. Another thing that we've learned over the last 10 years now that we're noticing is that people who snore, so maybe you may not know it, but your spouse or your mate may know it. People who snore often have an undiagnosed disease called sleep apnea, and we're realizing that there is a really close relationship with sleep apnea to high blood pressure, sleep apnea to sudden cardiac arrest, sleep apnea to heart attacks. That's basically when you stop breathing during sleep. And one of the hallmarks is, first of all, you're snoring a lot. And number two is your spouse or mate may recognize that you just flat out stop breathing for 10 seconds to 20 seconds. That's a problem. If you can imagine yourself, if you hold your breath for 10 seconds, it feels uncomfortable after about 5 seconds, right? Imagine doing that 100 times a night. Many people with sleep apnea actually do that. That's nothing but stress. That's increasing blood pressure, increasing heart rate, increasing your adrenaline. So all that contributes to heart disease and so forth.
Wow, I definitely snore, so I have to look into that.
So what you do is, what happens is you talk to your doctor about, do I have sleep apnea? There's some tests that we do to see, and there's great treatments that are actually cured. And actually people say they feel much better when they use the treatment.
If you're experiencing chest pains, would you go to your general practitioner, or is that something you have to go straight to a cardiologist for?
Yeah, so you definitely don't have to go straight to a cardiologist. So the question is, if you're experiencing chest discomfort, what should you do? Do you go to the doctor? Do you go to the primary doctor? Do you go to a cardiologist? No, I think that the primary doctor is more than sufficient to be able to figure that out and see exactly what's going on. And now, if it's too intense, we really suggest that you go to the emergency room. They'll be able to, first of all, make sure that it's nothing dangerous. Chest pains can come from a number of reasons, but most importantly, the emergency room is designed to ensure that it's not a heart attack or some sort of blood clot in the lung or some sort of catastrophe that they have to address right then. So I think that it's reasonable. If it's been going on for a while, I think it's reasonable to go to your primary doctor. You don't have to go to a cardiologist, but if it's starting to happen suddenly and it's starting to become intense, you really need to go to the emergency room.
And it's still okay to go to the doctor just to get a checkup, like on your heart, even if there's not any symptoms, just to
we've gone from reactive medicine to proactive or preventive medicine over the last 20 years. So what does that mean? That means that we're trying to predict who's going to have problems, number one, but more importantly, we're trying to prevent people from having problems. For instance, if I know that your mom or dad had a heart attack at the age of 50, I'm going to be pretty aggressive with you, ensuring that your blood pressure is controlled, ensuring that you're not diabetic, ensuring that your weight is controlled, ensuring that your cholesterol is controlled, ensuring that you don't have sleep apnea, and also ensuring that you're eating right and exercising right. Those are the things that we think about. Whenever we see a patient, we're always thinking of you as a risk. We say, is your risk high or is your risk low? If your risk is low, then we may be less aggressive. But if your risk is high, then we need to be aggressive to try and prevent the things that happen to you, that happen to your parents, and prevent them from happening to you.
Definitely. So it seems like men are a little bit more nervous, or I'm fine, I don't need to go to the doctor. What would you say to them?
Men are pretty stoic. Men think that they're going to live forever. Men think that they can do everything forever, and that's a problem. And I'll touch on that. Men, from a society standpoint, from a heart standpoint, we have done a good job convincing men that they are at risk for heart disease, but we've done a terrible job convincing women that they have heart disease. And in fact, women over the last 30 years, we've recognized have had higher incidences of heart disease than men. Why? Because women don't believe that they can have heart disease. We did a great job with breast cancer. So many women go get mammograms, but women tend to forget that they have a higher chance of having a heart attack than having breast cancer. So we have to remember that. But in terms of men are pretty good. But trying to convince a man to go, you just have to convince. And I tell you, the person that really convinces a man to go to the doctor is usually their spouse, or their significant other.
Definitely. Are there any other Facebook Live questions?
Yes. How do you treat AFib AFib, AFib patients?
Yeah. So AFib. So that's a kind of a specific question. That is a form of heart disease. That is an electrical problem. Atrial fibrillation, or AFib for short, is one of the a disorder that is an electrical problem, not really a heart muscle problem. Your heart's not going to stop with it, but it does cause fast heartbeats, and it can cause you to have palpitations. And the best treatment is to see your doctor about it. The one thing we do know with AFib is that you do need to be on the blood thinner most of the time, because it can lead to strokes or brain attacks. But that's kind of a separate question in this regard. But AFib is usually treated with medicines and seeing your doctor and blood thinners.
How can you exercise your heart?
Yeah. So the heart. How do you exercise your heart is the question. Well, the heart is a muscle, just like anything else. Just like your biceps muscle. What do? We lift weights to get your biceps bigger. We do bench press to get your pectoralis muscles bigger. The same thing happens with your heart. You want to exercise that heart. If you don't use it, you lose it. So I like to have people do cardio exercise. Everyone asks me, can I do exercise? I go to the gym, but all I'm doing is lifting weights. You're not really doing cardio. Cardio exercise has the term cardio because it's designed to get your heart beating. That includes walking, doing elliptical. Swimming is probably one of the best forms of exercise that you can do.
Yes.
So anything that can get your heart rate up is a good thing, I think. And that's usually what we consider cardio exercise. But you should talk to your doctor about that. But a lot of the trainers at health clubs, they know what cardio exercise is.
Okay.
So that's how you train your muscle, your heart muscle, to be strong.
How do I know if I'm having a heart attack?
You don't know. That's number one. So how do you know if you're having a heart attack? I think the number one thing you can do is think that you're having a heart attack and get it checked out. The last thing you want to do is blow it off and it's really not. There's nothing wrong with going to the emergency room. There's nothing wrong with going to your doctor. You have to know your body. If you notice that you're having chest discomfort, if you notice that you're having indigestion that is not responding to antacids, if you notice that you're having discomfort with walking in your chest and it goes up to your neck or your jaw, or it goes down your left arm, that's classic heart symptoms, and that's when you need to get it addressed.
So, I know you just answered this, but is there any way to really tell the difference between like a heartburn and a more serious situation?
Yeah, so one of the biggest masqueraders that I've had in my career that I see is heartburn. I'll tell you a story. So I was at my house one night, and my neighbor, who's you talked about the men being stoic and they don't want to do it. This guy is a mean old guy. Lived in the neighborhood. Nobody really liked him, but he liked me. So he came to my door one night, and around 10 o'clock at night, I said, "Who's this at the door?" And he knocked on the door, and he says, "Doc, I've been having heartburn all night." And he comes to me with a box of Pepsid that's empty. And he says he's been taking Pepsid all night long, and he's taken probably 50 of them, and the heartburn's not going away. I said, well, if you take one, it may not go away, but 2, it should probably go away. 50, it should definitely go away. So after about 20 minutes of convincing him to call 911, he wouldn't let me call 911. I drove him to the hospital, and he was actually having an active heart attack right there. We rushed him into the cardiac cath lab and opened up one of his heart arteries, kind of like what you see on the back of on the screen here, and we were able to save his life. But that's the type of thing we're talking about. You got to have first of all, you have to think it in your mind that potentially you're having a heart attack, and then you have to address it.
What about, a lot of people are asking about the difference between men and women. Are there different symptoms, signs, or anything that we need to take note of that becomes different between the two sexes?
Yeah, so the American Heart Association has tried to hone this in over the last 3 years with the Go Red campaign, in a sense that, first of all, women can have heart attacks just like men, or even more. But number 2, women's symptoms may not be as typical as I described earlier. I described, the whole Fred Sanford, I'm having a chest discomfort, Elizabeth, I'm coming to see you, my chest hurts. That's usually what we think of as heart disease, heart pain. It's not usually that way. Men may often, they more classically will have chest discomfort, radiating, going up to your neck, going down your arm. But women may just have shortness of breath. Women may have fatigue. Women may notice that for some reason they just don't feel right. Those are the symptoms that we need to understand that women may have that. Yes, if you're having chest discomfort radiating to your neck and going to your arm, it may be heart disease. But but it may not be. There's some subtle symptoms that may not be present, or is something that we need to make sure that we address when it happens.
Okay, thank you so much. And so, are there any tips for keeping healthy that you would like to give us?
Yeah. So the number one tip that I can suggest is, for sure, know your numbers. What do I mean, know your numbers? So I mean, know your cholesterol, know your blood pressure, know your A1C. That's a number to look and see if you're diabetic or not. And if your A1C. So if your A1C is elevated, then you should get it addressed. If your blood pressure is elevated, then you need to address it. If your cholesterol numbers are elevated, then you need to address it, whether that's with diet or exercise. But know your numbers.
How often should you be checking those numbers?
At least once a year.
Once a year.
With your primary doctor. They know them well. But that's the number one thing I suggest. Know your numbers. Number two is don't smoke. Smoking is clearly related to heart disease. No matter what the general public says, no matter what the tobacco companies say, it is clearly related to heart disease. Number three is exercise. I mentioned earlier, you don't have to run marathons to exercise. You need to be active. You need to park at the back of the parking lot rather than in front of the parking lot when you go to the store. You need to take the steps when able. You don't need to take elevators. You need to walk at least 45 minutes to 50 minutes 3 times a week.
Okay.
That's that. And then the last thing, and I'm surprised this wasn't addressed, is that we need to address stress. Now, stress is interesting because it's really a perception of it. Okay, one person's stress maybe not. It's really relative. One neurosurgeon's stress, when someone's dying, may be just as stressful or maybe less stressful as somebody who is doing something else, a little bit mundane activity, or is worried about their boyfriend or something like that. So it all depends on you. But the number one of the things you can do is try and reduce stress in your life, because we know that's not good as well.
I think we have one more question.
We have a few questions. So how can I tell the difference? How can I distinguish between chest pain from a chest workout or from working out and actual heart pains?
Chest discomfort from working out often is going to be pain that is associated with the muscles. So for heart pain, it's very difficult to make heart pain up. So in other words, you can't reproduce it. You can't press on your heart pain. If you press on your chest and that hurts, it's probably not heart pain. Not always, but that's probably not. That's really the main way. I'm always concerned when people say they exercise, they get discomfort, and then it goes away after that. That could be a heart pain, or it could be some sort of muscular pain. But the way that I usually tell is that if you can press on it, or if you can reproduce it, if you squeeze your arms real tight and it hurts, if you open your arms real wide and it hurts, or if you press on your muscles and it hurts, it's probably not heart pain.
Okay. What are some...
A couple more questions.
We talked about stress. What are some ways that people can really alleviate that?
Interestingly enough, one of the ways that I've read is that definitely being more spiritual is one way. There's data suggesting that people who go to church have less stress than others. So I thought that was pretty interesting. But there's lots of different ways to reduce stress. Number one is trying to reduce stress within your life in terms of different people. But there's also stress-relieving activities, whether it's reading, whether it's meditating, whether it's doing yoga. Those type of issues, those type of activities definitely are different ways to reduce stress. A few times in my career, which I don't like to do, but I have stopped people, I have suggested people change their profession. Yeah, and I understand you need money. Everyone needs money and you need to live. But changing your profession sometimes can help, because stress at the workplace can be difficult to get rid of.
Very.
And but it's also your perception. One of the things we talk about is it can always be worse. So you just have to remember that it can always be worse, and try and keep that in mind.
Stay relaxed.
Stay relaxed.
Okay.
Well, thank you so much. I think we have just one more question.
Just to help wrap it up, can you just give us in summation 5 things we can do right now to make a big difference for our heart?
Sure. So I kind of alluded to it earlier, but I'm going to try and make it concise. Number 1, know your numbers. Number 2, don't smoke. Number 3, exercise.
Okay.
Number 4, eat as close as you can to a plant-based diet as you can. Everything in moderation, but really low moderation. When I say eating meat, I'm not talking about just beef and chicken. I mean beef and pork. I'm talking about chicken and turkey as well. We think fish has some value, but it's not the fried fish. It's really white fish that we say is probably of value. It has some ingredients called omega-3 fatty acids that seem to help with your cholesterol and so forth. So vegan, vegetarian, or pescatarian are probably the best options in terms of diet. And then 5th is trying to reduce your stress.
Stress. Perfect. Do those 5 things. Thank you so much, Dr.